Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. We're at episode 120, and welcome to March. It is March 2020. I'm losing my voice today with all the dry weather and wind, so I wanted to get this recorded as soon as possible, and hopefully my audio will be good enough. I've turned it up higher, but as you know, sometimes it just doesn't work, but I'll do my best. The Codecast goes on rain or shine, sickness and health, and until 1,000,000 episodes do we part. So we're here for the duration. And today I wanted to try something different. I wanted to talk about knees, and with the cold weather that we've had and why knees hurt, and then talk about the coding for the different procedures. I'm hoping the preclinical or medical workup that leads to the coding may be a way for you to picture what you're coding and give you some insight that you may not have had before. I like to do this with my basic coding workshops as well, because one thing that I find most often that can be a downfall to a coder having success is the lack of training and really the understanding about a procedure they're coding. So hopefully this works on a podcast, and I will enjoy your feedback for those of you that actually listen in. But first, the Codecast podcast is brought to you by Keck Medicine of USC. Over 500 internationally renowned doctors at a leading academic medical center, keeping you healthy, on track, and doing the things you love. The Keck Effect, Los Angeles, California. Okay, so now let's take a look at knees here. And knees can be very complicated. And I just want to, they have a lot of moving parts. And because you use them a lot and you can't really walk around without your knees, so it can be a little bit tough when it comes to something going wrong. So you've got different parts. I'll give you a couple of terminology lessons here. So you have the femoral condyle, the anterior cruciate ligament. I'm sure you heard about your ACL, the lateral meniscus, the medial meniscus, the fibular collateral ligament, so the FCL, the patellar tendon, the medial collateral, the femur, the patella, and then the quadriceps tendon. So there's a lot of moving parts everywhere. There's also the posterior cruciate ligament, the PCL. But because your knees have so many using parts and you use them a lot, lots of things can go wrong, such as too much of one kind of motion, especially if you don't work up to it, and that can lead to what they call overuse injuries. So simple wear and tear is a problem, especially as you age. So for those of us that are getting older, sometimes that can really be felt because we're not as maybe active as the next person is. And so when you have accidents, that can crack bones and tear tissue. With some conditions, your body attacks its own joints. So your doctor can help you sort out what's going on with your knee when it doesn't feel right. And for those of you in the orthopedic profession, that's what your physician is there for, is to try to figure it out for the patient. So dislocations and fractures. So if your knee hurts intensely after a bump, a bang, or a fall, you may have broken one of the bones that meet up there. So the thigh, the shin, the kneecap, or when it maybe has shifted out of place. So if you feel that way, then obviously an emergency room visit or urgent care visit is important. But sometimes fractures can happen slowly. And what they do is they cause tiny cracks at the ends of the leg bones. And that can happen when you've started maybe using your knee a little bit more. Torn anterior cruciate ligament. So what is that? So sometimes you might hear a pop and you can't move after you suddenly change direction. And maybe you're playing soccer or football or basketball. You may have torn your ACL. And when that happens, remember the ACL, this connects the femur and the tibia and prevents the tibia from moving too far forward. So your knee will hurt and swell and feel unstable. Or you can tear or strain any of the tissues that hold your knee together. And just remember, ligaments connect bones to each other, tendons connect muscle to bone. Irritated tendons from using them too much, that's called tendinitis. So everything has kind of a domino effect. Iliotibial band syndrome. So the IT band, that's the ligament that runs along this outside of your thigh, and you can rub against the bone and get irritated and swollen. The more likely you can get this is when you run or ride your bike for exercise. For those of you runners out there, just so you know, running is not a great exercise for you. It's something that a lot of people do, so I'm sure I'll get a little bit of backlash for it, but it is very, very hard on your body because it's an impact exercise. It might hurt if you go downhill or if you sit for a while, and you may feel better after you warm up, but if you don't rest the injury and give it a chance to heal, that could get worse. So that's one that's really kind of hard to recover from once it gets irritated. Now, osteoarthritis, I'm sure you've heard that quite a few times because osteoarthritis also is one of the covered diagnoses when it comes to knee surgery. So it can be tough to bend or stretch your leg, and your knee may feel stiff or sore and may swell after you've been moving around. You've probably worn down the cartilage, and that stuff, remember, that's the cushion at the ends of your bones. And because that takes time, this kind of arthritis is really more common in people that are 65 and older. If you're younger, you may get it because you've used your knee a lot after an injury, kind of like a ligament tear. And so that's where that develops from. Because remember, once you've done something to your body like a tear or a sprain, strain, or anything where there's a little bit of a damaged cell, your body tries to compensate for that. And so it will start to grow some tissue over it or grow something over it just so that it can basically, again, compensate for that area. Inflammatory arthritis is a little bit different. So besides pain and swelling, if you start to feel tired, sick, or feverish, or when you have an autoimmune disease, your immune system, it's meant to fight off germs and it can attack your knees. I've seen that happen quite a few in patients. For example, if you've heard of rheumatoid arthritis, this tends to affect hands and other joints in pairs on both sides of the body, and lupus goes after joints, muscles, and organs everywhere. Psoriatic arthritis, that starts with a PS, often causes thick, discolored patches of skin along with joint pain. So inflammation, that means that things are swelling, and you're trying to get that swelling to go down. Now, bursitis, again in the knee, this makes your knees swollen, stiff, and you'll feel kind of warm or tender to the touch. The other is more internal when you move around. But this is also because you've probably overworked the knee. This is also maybe called housemaid's knee or clergyman knee because people with these jobs are kneeling so much. It happens when small fluid-filled sacs called bursa help cushion your knee joint and they get irritated or swollen. So you may even ache when you're resting if you have bursitis. Now, runner's knee, this is pretty common, mostly in women and young athletes. You'll feel this in front of your knee, typically around the kneecap or patella. Your knee may hurt after you sit with it, bent for a while, or when you try to kneel. So it may pop or crack when you climb stairs. You may hear something called patellofemoral pain syndrome, and that comes from overuse, misalignment between your hip and your ankle, a weak thigh muscle, or a breakdown of cartilage behind your kneecap, or a combination of all of those. So women have to be ultra careful about that. A torn meniscus, so if you suddenly twist or pivot, and especially if your full weight is on your knee, and that's why when you see running backs playing football, or if you see a basketball player go right or left, that can tear a meniscus. That's the rubbery cartilage that acts as a cushion between the bones of your thigh and your shin. And you have one on each side of your ACL. So they are more susceptible to tears because of arthritis or depending on how old somebody is. And the older you get, the more it can be a non-contact injury. The pain can be really hard to pinpoint and describe. And your knee may get stiff, swollen, and really hard to move or extend. And typically they'll say you need to have something to clean up that area. That's what they're talking about. A Baker's cyst, so you see that there's a ball behind your knee. This fluid sac behind your knee, and that's the back of your knee, it bulges a little bit. Sometimes it can get so tight that it's hard to fully bend or stretch your leg, but it could be caused by arthritis or a tear in your meniscus, and it's affecting the back of the knee. The cyst itself usually doesn't hurt unless it bursts, which can make the back of your knee and calf swell and also bruise up. And then something called gout or pseudogout. So both have similar symptoms. So pseudo, you've heard of basically something that is sort of like the actual disease. But the pain and swelling are often really intense and hit you really fast. Also, you're going to see discoloration. So your knee may be stiff, red, and very hot. And what happens is that crystals gather in the joint. And gout is a buildup of uric acid, and it usually affects the big toe. It just heads right down to the foot. Pseudogout is by calcium pyrophosphate that gets built up there. Now, if there's an infection, typically an infection, you'll also possibly have a fever. That's always your body saying, hey, this is why my temperature is going up, because it's trying to fight a fever. And also what happens is that there could be an other illness or direct injury to the joint, and they call it septic arthritis. The pain comes on pretty quick. You're probably pretty sick. Again, you're going to probably run a fever, and your doctor may need to use a needle to do what they call an arthrocentesis, or to take some fluid from your knee to figure out which bacteria is causing it, and they know how to treat it. It doesn't happen very much, but also you might see some viruses or a parasite can infect your joints as well. Now, something called referred pain, this is a little bit new. This means there's a problem somewhere else in your back, hip or foot, for example, but it can make your knee sore. What happens here is that your nerves move pain from one area to another, and your brain gets confused about the source of the pain signals. So the feeling is real, but there may be nothing wrong with your knee itself. And that does happen. Also, if you have somebody that is heavily medicated and also takes medication with certain alcohols, which you're not supposed to, that can confuse those signals in your brain, and you don't want to do that. So another good reason not to drink and take medication. So before surgery is actually an option, typically what physicians will ask you to do is they'll say, take something like NSAIDs, which are ibuprofen or naproxen. Basically what this does, it eases pain and swelling. They also may tell you to use the RICE method. That's rest, ice, compression, and elevation. And this can often help, and this is what athletes usually do. But the biggest thing is to get off your feet, and you want to raise your leg so it's higher than your heart, and then put a cold pack or thin cloth or towel on your knee for 10 to 20 minutes at a time, several times a day, and then wrap an elastic bandage around your knee when you're up, where it's snug but not so tight that it's cutting off your circulation. So when this gets too intense or sudden, now the patients are going to call us for treatment. And again, it could be medication, it could be exercises, braces, or that's when we get into surgery. So when we talk about the surgery, in this case, first we have something called arthroscopies. And arthroscopies basically are surgeries that have portal incisions. They're made on either side of the patellar tendon, and the compartments of the knee are examined using what they call an arthroscope. So that's arthroscopy. You can see that. And then a probe. And then if there's additional treatment besides just what we call the look-see, then you would basically code that specific service. And what you're looking at in your CPT book is you look at codes starting at 29866, which started arthroscopy of the knee, and then it gets into the rest of the services underneath that. Now, if you see something in your CPT book that says separate procedure, what that means is that has to stand alone. It means that it's not something that you can code for with anything else. So you want to always, when you see that diagnostic, 29870, when you start to see that diagnostic arthroscopy, that means that that's a base code. That's not the main surgical code. And then when you get into things like, let's say we're going to repair the medial meniscus, and there's a repair, there's to take it out, a meniscectomy. So you have to know exactly what the report says. Then you're going to be in codes closer to 29880, 29881, possibly 29882, and so forth. If you get into repairing the ACL, or the anterior cruciate ligament that we talked about, 29888. So those are all services that are using the scope technology, or I should say procedurally. Now, I do get questions every once in a while about arthrotomies. Now, arthrotomies are a little bit different because now these are typically what we call our open procedures. And when we look at arthrotomies, if you don't know what those are, basically this means that you're going to be opening up the patient. And so we want to just make sure that your physician gives you some information as far as what that means. So for example, let's say that the encounter notes indicate that the orthopedist performed a knee arthrotomy. How do you code for that? Well, first you need more information to be able to code the exact knee arthrotomy, just like the scope code. And there's 6 codes to choose from. So you'll need to know the difference between a few procedures along with the arthrotomy. So you might have 27330, that's with synovial biopsy only. 27331, that means you're also not only exploring the knee, but you're maybe doing a biopsy, or you may be removing loose or foreign bodies. Loose bodies are those things that, you hear when you get up and you hear the popping. And then 27332, that means you're also doing an excision of a semilunar cartilage, possibly a meniscectomy. Medial and lateral meniscectomy open, 27333. If you're doing a synovectomy by arthrotomy, then you want to have the 27334, and that's anterior or posterior. And then if it is anterior and posterior, then that's going to be 27335. A couple of terms, just a quick rundown, just in case you're a little bit confused. So arthrotomy, a procedure involving the incision of a joint. Synovial biopsy, that means you're removing synovial fluid, so that thick fluid located in the synovial joints, because they want to look at it from a pathological standpoint, see if there's an infection. Synovectomy means your excision of the synovium, so the membrane that lines the joint cavity in that area. And always remember, when you are doing any procedures on the knee, to use your laterality modifiers that link to your specific diagnosis. So LT is for left side and RT is for right side. So hopefully that helped you with any kind of knee situation you're dealing with. I wanted to give you the medical first, and then really talk to you about just kind of some of the codes that you might anticipate. Okay, so our coding question, I got one from a podcast that somebody listened to in December. It says, Terry, I listened to your podcast dated 12/24 on collecting deductibles and copays and not writing them off. I work for an out-of-network company who will bill straight Medicare coinsurance and deductibles, but would write off the Medicare 20% if the secondary was out of network. The price rate is 800% of Medicare. Is this illegal or legal? Okay, before I fell off my chair. So the first thing is that you can't write off the balance. Now, you're not supposed to be charging 800%. We recommend 200% of the Medicare rates. Medicare is pretty specific. Even if you are a participating provider and you are being held to what the allowables are, you can't overcode a patient or overcharge a patient, I should say. 800% of Medicare rates, that's going to get questioned. And so they're writing it off, basically saying that they did not anticipate getting paid. And if you submit a claim without expecting to get paid on any portion of that, then you're saying that's a false claim. And so again, I'll go back to that original podcast. Don't do it. You should not be writing that off, but that was very high as far as what you're charging and dealing with those services. So I would be very careful with that and bring that to your administrator's attention. Our coding question was brought to you today by HealthTerm, 100% web-based enterprise terminology system that enables data exchange and semantic interoperability in healthcare, a product of carecom.com. Okay, so I wanted to end my personal insight this week by just mentioning the untimely and sad death of one of my all-time favorite professional athletes, the Lakers' Kobe Bryant, and his 13-year-old daughter, Gianna. I met him a few times. I met his oldest daughter once years ago. So this hit me very, very hard. Kobe, we love you. We miss you. And to his daughter, Gigi, may she play endless basketball with her dad in heaven. Also, our thoughts and prayers go out to the 7 people who were also on that helicopter last Sunday. Our hearts are desperately with your families, and we really just pray for you in your time of healing. So everyone, take the time to tell people how much they mean to you. Tomorrow is not promised. Please make it a better week. And until next time, thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.